Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course,
Well,
Bob.
Brad, we actually listen to the people out there. They're asking us to answer some of their questions, and so that is what we did today. We're going to answer 7 of your questions about shoulder pain.
That's right.
Here we go.
Directly from our viewers, and we'll tell you.
We'll do what we can.
Exactly.
Okay, the first question is from Sandy F.
Sandy.
Yep. Hey, Sandy.
Glad you could. We could help you out here.
Well, I don't know if we're going to be able to help or not, but
I think we'll.
So we got bilateral frozen shoulders with MUA, which is manipulation under anesthesia. So she had it manipulated. She had some problems with these.
Right.
And arthroscopic capsular release to the right in 2017. So anyway, she had problems with her shoulders, frozen. They're doing better now. She's regained her range of motion back, but she has extremely tight traps. Trapezius. Do you want to turn around, Brad?
Yes, we don't know if her upper traps, middle traps are exactly what she's referring to.
Tight traps, discomfort in both shoulder blades, and she's tried acupuncture, PT, and massage. Any ideas you would have would be greatly appreciated. Well, my thoughts are, Brad, first of all, these might have came about because secondary to the shoulder problems, but they're not because of the shoulder problems. Shoulder problems don't tend to be back here.
Right. Right. I agree.
They're here, they're down
the
here.
The pain typically goes down there, not to the back. But things from the neck do refer down to the back in this area very frequently. So.
Yes. My guess, now we always have to guess here because we haven't seen this person, but we're going to give advice that would help you no matter what.
It's not going to harm anything.
It's not going to be harmful,
yes,
right?
Exactly.
My guess is that you've got a little bit of a rounded posture there. I can guess that because most people have a rounded posture there.
That's a pretty safe guess.
So if you treat this area with physical therapy and all these things and acupuncture, but you don't treat the posture, it's never going to go away.
Sure.
So what we're going to do is we're going to give you some ideas here. One, you could take just a regular rolled up sock, and especially if this is really tight and it's really been that way a long time, we got to start stretching it back the other way.
Right.
So what we're going to do, Brad, if you don't mind turning it again.
Sure.
We're going to have you lay on this sock, like not on the spine itself, but one side, this side, this side, this side, this side, this side. Now you can try a sock to start off with, usually on the floor, because on the bed or on a mat like this wouldn't be enough. But I just lay on there like this. You bring your arms up like this and stretch the elbows back. Take some deep breaths. You can even roll onto that sock a little bit.
Yep.
If it's really too much, even this is too much for you, you could start up against the wall.
So we're going to show you can advance to a tennis ball, but or if you could use a sock, it is a little bit harder. There we go. But you'll get it in there. And I like the ball because you can roll up and down.
Yeah.
And it's not so aggressive.
Yeah, tennis ball against the wall is a great way to start.
Yeah.
Because, like you said, you can control it, you can roll around on it, and it'll start to stretch out these structures. These are really, there's heavy ligaments in this area, so it's a tough area to stretch.
Right.
So like Brad said, you can eventually go to the point where you're laying down on the floor on the tennis ball, and you might even put a towel over it to soften it a little bit.
Sure.
Same thing, bring your arms up overhead. You can even bring your arms back and forth like this.
Yep.
You can roll on it. And then eventually, if you wanted to, this is a little bit pricey, but the back pod, Brad?
Yes, I use mine 3 days a week consistently.
I use mine almost daily.
Do ya?
Yep, and I can tell when I don't use it. Like one time I went to a wedding and I didn't use it that morning, and I was starting to get problems just from that one day.
Oh, Bob,
so
you're hooked.
I'm hooked. Yeah, I'm gotta have it. So this is the same thing. Basically, I just put it in one area like this, and I lean on it. And
Why don't you just bring this arm over so you can actually see? But so you can see it's not on the shoulder blade, not on the spine, but between
right
there.
Between, yeah. Yep. It's got the right consistency for me. Now, again, for most people, this will be too much for them to start off with. Wouldn't you say, Brad?
Yeah, like I put a towel that was folded over about 4 or 5 times and laid it over. But now I feel very comfortable. I actually welcome laying on this now.
It is pricey. Again, do you know remember what it is, Mike?
70, 80.
$78. So and this guy he's from New Zealand. It's very well made. You could drive a truck over it, but
Right.
I mean, you have to understand. I would probably start with something like this, less expensive,
Exactly.
and then to try it.
One thing, you can do all this, but if you do this, you have to monitor your posture when you're at your workstation, if you're on a computer, on your phone, sitting.
Yeah.
Think about this because this is going to help a lot, but it's not going to help at all if you don't
Yeah,
think
follow
about
up with it.
Yeah, exactly. So good luck. Is it
Good luck,
Sandy?
Sandy.
And we're thinking about you.
Yep. Okay, next question is by Brigitta or Brigitta?
We apologize if we
Yeah.
don't get it right, but
Brigitta? I don't know. Sorry. Last name starts with V. So, can we just call you Bridget? Can we?
I think she'll forgive us
All
if
right.
we're incorrect.
Bridget says, I pass all your shoulder tests, but I have pain in my upper arm. You know the old joke, doctor, it hurts when I lift my arm higher than this? And the doctor answers, so don't lift your arm higher than that. That's me with pain. Never thought I'd be old enough to be a vaudeville joke. She must be old enough to know what a vaudeville joke is, though.
Yeah.
So what is causing my pain and what can I do about it? So this is, again, is an issue here where we'd like to ask you some questions. We don't know what shoulder tests you did.
Right.
We're thinking you might have did the impingement tests and they weren't it.
Yep.
The fact that you know what a vaudeville joke is, being a detective here, Brad, means to me that you're a little bit older. Maybe that you're...
She might be our age.
Yeah, she might be. So when you start getting to our age, you start thinking about arthritis. And with arthritis, let's say, for example, you lift the arm, it hurts because it's tightened up, it's not moving. We do want to try to gain as much motion as possible. So we're going to show you, why don't we show two simple exercises with the Booyah stick.
Sure.
Now you can use any type of long pipe or anything with, you could use a broom handle.
A broom handle, you can use a piece of doweling, you know,
Right.
it's got to be just like this, anything.
Yep.
Or, we use a Booyah stick because they work really well. We use them with all our patients and ourselves, so.
So what's nice about this, what you're going to do is, Brad, can you show from the side angle?
Yeah, I'll show
I'll
it.
show from the front. So you're going to put this in place right on the chair next to you, or I'm on the bench here, and I'm going to reach up as high as that's comfortable. What's nice is you can kind of work your hand up there.
Yep.
And then you're just going to lean forward like this and stretch.
Now, if you aren't able to even to go that high, you can put the stick right on the ground. The thing is whether it's on the floor or the chair, it cannot slip and slide.
Right.
It has to grip. These have a nice rubber stopper. You could, if you got a soft chair, or put something that.
I know a lady that just took a broomstick and she taped it, and it worked pretty good actually. She put like duct
sometimes
tape
you have
on
to
it.
be creative.
Yeah.
So I'll do it on the floor. Bob's doing it
Yeah.
on the thing, but it's the same
You're
motion.
going to lean forward and you're really feeling a stretch in that
Right,
shoulder.
yeah.
Now this shouldn't be greatly painful.
No, if
There
you're
might
getting
be some stretching pain,
Yeah.
but nothing beyond that.
if it's getting sharp pain, you're going too aggressive.
Yeah, you're too aggressive.
Yeah.
Start a little bit less aggressive. And then over time you work your way up a little bit too then.
And being a woman, she's probably wise enough. If it was a guy, they would I'm gonna push it, and then their shoulder be all sore the next day. But
Yeah.
she'll do well.
You can do like a good set of 10, and if it feels good, you can do it a couple times throughout the day. And again, you can work your way up and stretch it even further and further. The next one you can do is you can actually grab the Booyah stick or the stick, put your palm down, facing toward you. This one can be palm out, facing away from you, and you're going to bring the shoulder back like this. Just doing some stretching like this. Again, should not be painful. We should be painless. Just go to the point where you feel the pain, but over time you can go further and further.
Right. This is one of those things where if initially you may only get to hear, but after a few days you'll notice, oh, wow. And if this gets better, it's oftentimes easier to reach around and scratch your back too.
Yeah, it improves your motion in a lot of directions by
Yep.
just working that one. So that's why I feel pretty comfortable with that one. The only people, I mean, if you have osteoporosis really bad, or if you had shoulder dislocations, I don't want you doing any of these.
Right. Yeah. If you're
So,
hypermobile. All
all
right.
right.
Well, very good.
Good luck, Bridget. We called her Bridget,
Yeah.
remember?
She'll be okay with us.
Okay, thanks.
Take care.
All right, next question is from Cindy. Her middle name is Richardson. Can I say that? I won't say her last name. R.
She might have two last names. You know, when you get
Oh,
married.
I see. You're right.
Could be.
Sorry, Cindy.
Well, just do the abbreviation. I think
Cindy RR.
that reminds me of CCR, the
Oh,
band.
yeah, that's right.
I wonder if she plays an instrument.
Rock on, Cindy.
Okay.
So, she says, can you recommend good exercises for shoulder bursitis and rotator cuff tendonitis? Are there exercises that are safe and effective to do if you have both conditions in the same shoulder? Good question.
It is.
The thing is, first Brad and I were discussing this. A lot of times you probably don't know if you have bursitis and tendonitis. You might have one or the other. They're very similar in actions.
The tissues, the structures are right next to each other. Their symptoms are similar,
Yeah.
as well as the movements often are similar that irritate it. So the treatments are the same anyway.
Are the same anyway. And usually it's caused by an impingement, meaning that do you want to show that real quick, Brad?
What?
The impingement or not?
I'm trying to hold back my cough.
Oh.
Yeah, but we'll show it. I'm doing better now. Oh, look at that. Sam.
So just real quickly, you can see a tendon here. We got pink tape on it.
Yep.
As you lift the arm, especially if you have
Right
like poor posture or things are a little bit out of sorts here, it can pinch right there. So that can pinch the tendon. It also can pinch the bursa
Right.
and cause inflammation. So what we want to do, again, one of the things that can really result in impingement is if you have poor posture. So that rounded out shoulders, your internally rotated shoulders. Yeah, if you stand and your palms are facing each other, you know, you want them kind of coming out like this.
Yep.
The more they're facing each other, the more your shoulders are rounded out. So the first thing we're going to have you work on is posture. Throughout the day, we want you to do W's.
Oh.
So you're going to go ahead and get up in as good a posture as you think you can, and you're going to go like this, squeeze your shoulder blades together. See how I'm making a W here?
Yep.
W stands for what, Brad?
Wisconsin.
I knew you were going to say that. So just
She could be
squeeze
from
together.
Wisconsin.
She could be from Wisconsin. She could be from Washington.
And how many, Bob?
I'd say, 5 to 10?
Yep.
Depending on how much time you have.
Yep.
And I want you to do these a lot. I've had people that have had a significant improvement in their shoulder pain just from doing these, Brad.
Right.
Without a doubt.
If you lift up like this and it starts to hurt at about here, and then just simply change your posture, do the same thing, and I bet you your arm is going to lift higher with less pain.
Yes.
And if that's the case, then for sure this exercise needs to be done.
We'll show you one more. This is to try to work on impingement. Is basically you put your hand on the back of a chair. Brad's going to show it with the booyah stick. Am I in that way, Brad?
Well, get your butt out of my face.
Should I go this way?
Yeah, we'll go this
Like
way.
that, okay. So I'm pushing down into the chair. Brad's like he's trying to stab the booyah stick down into the floor.
There you go.
I'm pushing down into the chair and I'm walking away at the same time. And that helps push the head of the shoulder down and keeps it out of the problem area there. Less impingement going on there. It's just a good stretch to do.
This one seems to me with people, either it works really good and they're just ecstatic
Yeah.
about it, or it kind of hurts. If it does hurt with sharp pain, go to the other exercise, the first exercise, and then come back to this one.
Yeah. So
All right.
definitely do the posture one. Check this one out and see if it works. Hope that helps you. What was her name again?
CCR. No.
CRR.
CR.
Cindy. Yeah.
Sorry, Cindy. We get camera shy and it gets our head. It's the age thing.
Yeah, thanks for watching. All right, next question. I seem to pass all the tests you have for shoulder, yet wake up each morning with shoulder upper arm stiffness, the right side basically. This, by the way, is from Susan B.
B. That's not her last name, but that's
Oh,
the initial. Yeah.
right, that's the initial.
Susan. All right,
Yeah.
Susan. That's a good
It's
question.
on her right side.
I think we can help.
Does she need new stretches? Does it make a difference that I'm on a computer all day? Well, again, we can't solve all the issues that are possibly going on here. For the computer, we just did a video on how to set up your computer. We did it last week on YouTube. I think it was something like ergonomic experts help you set up your desk at home or something like that. Just look up that title and Bob and Brad.
You definitely want to address your posture at your computer, but because in the morning you get up, we're also thinking that we're going to address the posture in your bed so that we can eliminate that. So when you come out of bed, you start the day out properly.
Right. Obviously, you're doing something at night that's making the arm sore.
Right. It's like our pillow. Today is a good day to have a good day.
Yeah, that's right.
So we're going to help you with this.
So let's start off, Brad. Let's say you're doing the worst thing possible. You're sleeping on the shoulder itself. Let's say a painful shoulder.
Yeah.
And you're like, I just have to do it. That's how I sleep. So if you lay on your painful shoulder, usually you want to have two pillows first on this side because you don't want to have your head down like this or you don't want your head like this. You want it right in the middle. But you're going to take the pain off the shoulder, you're going to take a little throw pillow like the Good Day pillow, and you're going to create a trough.
Or the canal.
Or canal, yep. And you're just going to lay in the put the shoulder in the trough. So now I'm taking pressure here. I'm taking pressure here. I'm taking less pressure on the shoulder. I sleep like this all the time, Brad. I keep this pillow here. And whenever I sleep on my side, I always have my arm in the canal. So, do you find that amazing?
And then when you lay on your back, you just move it out a little bit?
When I lay on my back, I don't lay on my back very often, to be honest with you.
Oh, okay.
But if you lay on your back and you have a painful shoulder, I do believe it there, Brad. It just gives me a good posture in my mid-back. But if you're going to lay on your back, I would take another pillow like this and place your arm on it like this.
Sure.
Just to give you some support for that arm all the time.
Now, when you do lay on your back, if that's the case, a lot of times two pillows is going to be too much. You're going to have to throw one on the floor or just get it out of the way. So
that's where you take the one pillow and you put it underneath your arm.
Oh, there you go, Bob.
Sure.
Yep.
Now, let's say you want to lay on the opposite side. Your arm this is the painful arm.
Sure.
Ideally, what you want to do, again, you're going to have two pillows, and you're going to have two more pillows. You're going to have lots of pillows.
But are you going to trough the one on the bottom?
It's up to you.
Yeah.
It's up to you. You can do that if you want to, but I'm looking at this one right now, Brad.
This poor woman's going to have to go to the store and buy a whole bunch of pillows or order them
pillow
online.
Sale, that's
pillow
for
all
sure.
over. Maybe she has a lot already.
So you're going to put the first pillow here, second pillow here. My voice cracked. And you're going to have the arm underneath, the pillow underneath the arm like this. The reason I have two pillows, Brad, watch what happens. If I only have one, it goes like this and it internally rotates.
And they fall down,
So you put two like this, and it keeps it up nice and safe.
Sure.
Some people sleep with their arm up like that. That's what I do.
Yeah.
I don't use a pillow for my upper arm. I just lay it on my on my body.
Yeah.
So.
But this is one of those things where you'll be amazed how when you get things propped and pillowed and adjusted properly, what a difference it'll make with sleeping.
I think some people get those body pillows.
Yeah.
That you can put your leg on, you can put your arm on, you can.
I use my wife.
I was going to say she would work too.
Yeah.
Or a dog, if you have a dog.
Yeah, or, well, we don't need to go there anymore. So good
luck.
luck.
Good luck. All right, next question. Can calcified tendonitis in the shoulder rectify itself? In other words, can it get better on its own, I suppose? She's had one steroid shot 2 years ago and still have pain. I just want to try everything other than surgery. This is by Nancy D. Hi, Nancy.
Nancy, I think you got the right idea. Try some other things. And I think there's a fair chance that you can rectify this without surgery.
Yeah.
I wish we could. It's going to be a little bit difficult without seeing you, but we're going to make some assumptions that we think are wise and give you the best option.
The first thing is always posture, because if your posture is bad, it's going to make the tendonitis worse. And the fact that it's calcified is not necessarily a problem if you have room for everything to move.
Right. I have a feeling this is one of those things like a bulging disc. There's people who have calcified tendons and aren't aware of it, and it doesn't necessarily affect them. But
in some cases it does.
Right.
So what Brad's saying, that quite often they find this with knees, shoulders, back. because we can do MRIs now, they do these tests and they see all these things that are just really part of the aging process.
Right.
It's just like wrinkles and gray hair.
Wow, we really don't know how old she is. She might
No.
be insulted by this, Bob.
She might be, but if she has calcified tendonitis, I think she's probably a little older, wouldn't you say?
Older than 20.
Yeah. So you're going to want to make sure you have good posture because that's going to leave more room for the shoulder, you know, the shoulder upper humerus to work better.
Right.
It's going to work well into the humeral head there. So we're going to do W's again. I
Okay.
mentioned this on another one. Just make a W. You're going to squeeze your shoulder blades together.
So from the side, it's going to look like
Yep.
this.
Throughout the day, you're going to do these. Like every hour, you're going to do these. Surprisingly enough, sometimes this alone can make a dent in your shoulder pain.
When you're doing, don't let your head go forward. I've had people
Right. Really good posture.
back
Really,
with the chin.
a little bit chin tuck even. So,
And this is good for your breathing. There's a lot of things that exercise is going to be helpful for.
so what did we decide we're going to show her now? We're going to show her the booyah stick again, right?
Right. Well,
Oh, yeah, you're going to show the sideways one, too.
Right. Now put your elbows right by your ribs like this and kind of, I tell my patients, pretend your elbows are glued to your ribs and then go out like this. And if you find that one goes way out to here and the tight one only goes about to there versus out to there, we need to loosen that up. So you can take a cane, we use a booyah stick, it doesn't matter.
broomstick.
Yeah, broomstick. I usually go palms up, elbows again, glued to the ribs, don't let them pop out, and work back and forth. And you'll find that, like the tight one, when you get out this way, you're going to feel a stretch. If it's sharp pain, don't push it. Don't get too aggressive. Just bump into it. If it's just a stretch. You know, do this.
Very good posture while
Yep.
you're doing this. Work on your posture.
Good point, Bob. And, do 10 of those and do that 2 or 3 times a day. And over a few days, you should increase that range so it equals the other one. Along with the increased range, the pain should be coming down as well. The other one, we figured that probably flexion or reaching up in
Yeah.
front of you is a common.
I know we show this a lot, but there's a reason we show it a lot because it helps a lot of people. So basically, again, you're going to take a broomstick or some type of rod, and you're going to have to put it, maybe have a cushioned bottom on it. Like sometimes people just put tape on it. A booyah stick obviously works too, but you're going to lean forward like this and put some traction on the shoulder, and it also stretches the shoulder into flexion here a little bit. So you can do pressure on, pressure off. You can just also do where you just lean on it for a while. And if this is too painful, start lower down yet.
Right.
Move your hands down lower.
I'm doing it on the floor. This is an option. If you can't reach up as high as Bob is and you don't get to hear, you
Right.
can do something off the floor.
So again, we apologize for showing this more than once, but it does work for a lot of people, so that's why we mention it.
Yeah,
so,
and it's simple to instruct over a video.
right, especially if we don't know what's going on. And that was Nancy D, right? Yep. Good luck, Nancy D.
All right, Nancy, thanks for writing in. We hope that shoulder improves
Yeah.
dramatically.
Hope it gets better. Okay, next question is from Linda HB. Again, I don't know if that's a hyphenated name or if her middle name is H. So,
And the last name is B?
and B, it's funny, my wife's name is Linda, and now we are finding out that often that means that you are older. So if we are thinking you might be 50 or older.
Wow.
So
Wow.
I'm doing my detective.
Yeah, well, yeah, I don't know. But anyways,
So here's
Linda,
a question.
yeah.
How do I know if I have a damaged rotator cuff? What is the best non-surgical treatment? And by the way, that's very wise because even if you do have a damaged rotator cuff, you got to check with your physician because there are some rotator cuffs that'll actually could get worse if it's a huge tear. But with most of them, you do want to try conservative treatment first.
Right, exactly.
So the easiest, there's a couple ways to determine this. One of the best ways is just to check drop arm test.
Yep.
So, if you try to raise the arm first off and you can't even raise it, you're doing this thing
Yep.
and you're trying to lift it, then you probably have tore a tendon. And it's just.
I've
not
had
done.
that. It's like
Yeah.
you use your body to help lift it up. But, I mean, you're not thinking about it, but because the body's trying to compensate to lift. And
But let's say you are able to lift it. Let's say I'm able to lift it there. Then you could take your other arm or have somebody else just push on it.
Just one finger,
And you're not able to hold it up.
it
You
just
have no strength.
yep drops right down.
So,
That's why it's the drop arm
Drop
test.
arm test.
Yep.
Brad, you were also going to show.
Oh, right. Yeah. Say this is your sore shoulder. So with your good one, and I'm going to show you from behind, I'll say to my patient, can you reach behind as far as you can? You can reach below my collar. In this, I can reach up to the middle of my back. And if you've got a really a torn rotator cuff, chances are you won't even be able to get to here. To get this is almost not going to happen. And then back here, oftentimes you can't even get past your buttock to get to your belt line. So that is pretty dramatic. Good side compared to the painful side.
So what would you try for it? There's a lot of things you can try, and we have, we're actually coming out with an entire video series on this.
Right.
But the one thing you can try is hanging. This is by Dr. Kirsch. Basically, you find a pull-up bar or some type of surface where you can grab onto.
We'll pretend this is a pull-up bar.
And you're going to work on just simple hanging. And he has you start off with like 10 seconds.
Yep.
And you work your way up to maybe 30 seconds.
So you don't do it sitting on a chair like this. You're actually hanging your whole body weight on the bar. And initially, you may have to start out easy, but you should be able to get your whole body weight up there.
Right, or you can do partial body weight.
Sure.
And you can work up to, he does it for almost like 10 minutes total. Not total hanging time, but he'll do like 10 seconds on, 30 seconds off, 10 seconds on.
And I think you'll go up to 30 seconds.
Yes, 30 seconds.
Straight, yeah.
Yep.
Yeah. But,
that's a long time.
if you Google Bob and Brad and then put hanging, I think you'll get some of those videos that'll go detailed on how to do that.
And Brad's going to show you just one strengthening exercise for your shoulder rotator cuff muscles. This one's one that you can often start fairly soon, and it's fairly easy to do.
Right. So the movement is this. It strengthens your external rotator cuff muscle, this is kind of like the go-to strengthening exercise where you'll start with. And if you have anything elastic or an elastic stretch band, this happens to be one of the loop. You don't need a loop on, but you're just going to get this motion. The elbow needs to stay close to the body, and then we're just going to start. And I'm just going to hold with the other hand and go out like this.
Yeah, a loop probably wouldn't even be the best, would it? It'd probably be more you want just a band.
Right, exactly.
Stretch band.
But on this, I have a lot of people with rotator cuff problems is they get to a certain point and then it starts to hurt and then come back in. So you don't go past the pain, you go up to the pain and do 10 of those. And day after day, with any luck at all, you're going to find that you can go farther and farther out because the other arm will show you that the normal range and the sore one typically does not go as far, and then they'll equal out and get stronger.
Yeah, if it for some reason makes it really sore after you do this, then you got to back off.
Exactly
and you
right.
Know what you're doing. So, good luck, Linda.
Yes. Okay.
Next question: what are good physical therapy exercises for shoulder impingement? We've gone over some of these already on the question and answer series. This is by Stephanie W.S. Hi, Stephanie.
Good afternoon, Stephanie.
So it really is very common that shoulder impingement is one of the issues that you're going to run into with shoulder problems.
Sure.
So we do have to mention this again, is posture. It always starts with posture because posture could be causing the shoulder impingement.
Sure.
So if you don't correct that, all the other exercises are not going to do you any good.
Sure.
So all we're going to do is give you a simple one. We're going to do the W exercise because it's one you can do throughout the day. And Brad, do you want to show it from the side?
Yes, I do, Bob.
And what you want to do, make sure is do a little bit of a chin tuck. And then you're going to put the arm into the W fashion here, and you're going to squeeze your shoulder blades together.
W?
W.
For winning.
For winning or Wisconsin.
There you go.
You always say Wisconsin. Or it's an upside down M for Minnesota.
Yeah, well, Minnesota is upside
down right now, that's for sure.
I wonder where she's from. Anyways, yeah.
So you squeeze those shoulder blades together, just rip off like 5 to 10 of these, and do them quite often, like every hour if you can. This alone can make a big difference in your impingement.
Right. You're going to also just simply avoid things that irritate it. So if reaching up overhead irritates it, use the other arm. I've had people use the other hand and help, as long as you can do it without pain and it works that way. That's an option, I guess.
We've been showing this one all week, but this one also helps is you're going to go ahead and take a stick, take a broomstick, whatever you have. You're going to go ahead and grab onto the pole and lean forward like this. Then you put traction on there. It also helps set that humeral head back where it's supposed to be. I think and it stretches the capsule a little bit too to give you a little more room,
Yep.
Brad. This is just a great stretch to do. If that hurts, don't go up as high.
Yeah. You can start on the floor with it like you have here too, if you can't get that high.
We are looking for a painless exercise here. You can bump up against the pain, but if it hurts, we don't want to do it.
5 to 10 reps of these. You can do these every 1 to 2 hours throughout the day. And if you can't do it that often because of work or whatever, try to get it in at least 3 times a day.
And to throw something different in there, we're going to go ahead and show you a strengthening exercise.
Bob, you know, in the future we should ask these people, they may not want to reveal it as their age. And the reason is
Very
because
good question.
that gives us some
Right.
indication of
What the problem really
what the
is.
problem is to help zero in the exercise.
We'll do that on next week.
There
We'll
you
ask
go.
Age too. Then we'll start getting into what's your preferences on men.
Bob, don't go
Yeah.
there.
So we're going to go ahead. This is just one simple strengthening exercise you can do. You can go ahead and grab a can of just they
Soup.
generally like they weigh a pound, like a can of soup.
12 ounce, 16 ounce.
I have a
whatever.
little bit of a dumbbell here. This is actually 3 pounds, but I'm just going to do some outies. We basically call these or external rotation. here.
Yes.
So again, this should also be pain free. Sometimes people put a towel. Well, not really on this way, do they? Only when
Right.
they're standing up, they do it.
Do it the improper way so they can exaggerate.
Like this?
Yeah, the elbow has to be down in the
Yeah,
body.
it has to be locked into place here.
Yep.
You can just go up to level to start off with to see how you tolerate that, and then you could go up further over time. But this is just helping strengthen the muscles so that they work correctly, the rotator cuff muscles that help set that humeral head down in the socket so
Right.
that it doesn't impinge as much.
Did you say how many reps?
Oh, no, I didn't.
Yeah, I think usually typically 10 to 12 reps is a good way to start, and you can rest and do 1 or 2 sets, even 3 sets as you get stronger.
Yeah, and I wouldn't do more than 3 a week. Like do this 3 times a week. Do you know what I mean? I would do it like every other day.
Oh, sure.
and
Give it some
and,
rest time.
um,
But the posture ones,
The posture all the time, every day, every hour, as much as you can.
every hour on the hour.
That's right. Thanks for
Very
everybody
good.
for watching.